oneSOURCE is a facility-wide database solution with the tools to help healthcare facilities worldwide save time, space, and money. Online since 2009 and present in about 80% of U.S. hospitals, oneSOURCE is the world's most complete database service of manufacturers' instructions for use and biomedical maintenance documents. Ours is a subscription-based service that allows us to partner with our clients daily. We believe that when a facility can access the current manufacturer's biomedical maintenance documents with just the click of a mouse, everyone wins.
Well, my name is Chad Matson. I'm a CVET, CLRT with 10 years experience. I also teach in the local associate's degree biomedical program in Milwaukee. My experience as a biomed had shown me that there is a very huge need for an easy access to the biomedical documentation for healthcare facilities. And when oneSOURCE approached me to join the company, it was a no-brainer. They're the most comprehensive place to find those biomedical documents. So what we saw in the healthcare field was that Joint Commission and CMS were really looking for healthcare facilities to have those PM requirements by the manufacturer to not only apply to their daily routine preventive maintenance, but also because they needed to prove why they were on alternate equipment maintenance schedules, and to prove the reasons for that, you have to have those documents from the manufacturer. We tried to, as an organization, develop a database on our own. Just the man hours alone, we couldn't do it, which is what Joint Commission has put forth and put as a requirement for all the healthcare facilities out there. oneSOURCE is a web-based database available online all the time. It's a central location for all your biomedical documentation. There are also Android and Apple apps available, so you can take it on the go. So wherever your techs are, whenever they need access to those documents, they can get to them. There are unlimited users within your facility. So no matter how many techs you have using the database at one time, everybody has access to the documents no matter where they are. oneSOURCE has a dedicated staff that their sole purpose within our company is to acquire manuals to upload to our database. Most of our staff on the biomedical team are biomeds, so they know exactly what they're looking for. The other thing that we have as a huge selling feature for our database is that we have an update staff, and their sole purpose within our company is to go back to those manufacturers and make sure we have the most up-to-date document in our database for you to access. So when you perform a search, what is returned on the search screen is the make, model, description, review status, and also the review date. And most importantly is that PM frequency is displayed right on those search results. When you click on the Show Document button, it'll take you right to one of our cover pages. On that cover page, you'll notice that there's a link to PM procedures, troubleshooting, and parts breakdowns. Most of the documents contain these. Those links will take you directly to that information that's pertinent to your technician, saving a lot of time. Another feature of our database is the favorites list. In that favorites list, you can categorize equipment however you would like. Most of our clients categorize it by technician, but it can be categorized by equipment type, by PM month, whatever makes sense to your facility. Our database contains thousands of makes and models. We've always grown our database based on client needs, so whatever you need is what we put on the database. We do contain lots of letters of obsolescence and end-of-life letters, so that if that device you have is no longer serviceable, you can take that proof to your floor manager and get that device replaced. Most of our documents are accessible to most of our client base. However, there are many manufacturers that require you to prove training or purchase documents. If you provide these documents to us, we can house them on your exclusive portion of the database, and they will only be accessible to you. Whenever we sign a new client, we do always have a kickoff meeting. In that kickoff meeting, we try to assess the documents that you want to ensure that we have on our database. Beyond that, when you search for a document and you don't find it on our database, you can click on the Submit Document Request to request a new document. That submitted request assigns directly to our team, and 80% of new requests are up within 2 days. oneSOURCE already interfaces with a number of CMMS companies, and of course, just like the database, we expand that based on client needs. oneSOURCE can help third-party HTMs differentiate from their competition by helping their hospitals and clients be in compliance with the new Joint Commission and CMS requirements. When your technicians have to focus their time and energy on retrieving documents from the manufacturer, they aren't focused on their true duty, which is maintaining the hospital's medical equipment. When oneSOURCE takes over that duty for you, they save you time and money.